starts in 3, 2, 1, go.
Hi, Assalamualaikum. My name is Sheikh Muhammad Fazrein bin S.ABDUL Hadi. So before we proceed, I would like to introduce my group members, which is HEIQAL, Aiman, ATIF, and SHARMILLA. So we are from SR2433C. Today we would like to explain about the musculoskeletal condition on your shoulder. So the content in this topic is anatomies of the injuries, common injuries at the joint, mechanism of the injuries, procedure of special tests, the do's and don'ts, and equipment required. Then, what are you waiting for? Let's go!
So I'm going to explain about each part of anatomy injuries, which is AC joint, rotator cuff tears, and shoulder impingement. For the first one is AC joint, or known as the acromioclavicular joint, that located between our acromion and the clavicle. So when the AC joint injuries occur, it will cause of a separation on our joint between acromion and the clavicle. Basically, there are two types of injuries for the AC joint, which is traumatic and the overuse. Traumatic is a disruption of joint due damaged ligament that hold the acromion and the clavicle, while overuse can occur for over time as a repeated and can cause of excessive stress on our joint. So the next one is the rotator cuff tear. The rotator cuff is located at the head of humerus and the scapula and also attached to each other. So the tendon of rotator cuff consists of 4 muscle groups, which is supraspinatus, infraspinatus, the teres minor, and also the subscapularis. The function of supraspinatus is to hold our humerus in keep place. For the infraspinatus, help to rotate and extend our shoulder, while for the teres minor, help in adduction and abduction of our arms. For the subscapularis is to hold our humerus bone to scapula. Basically, when our tendon of rotator cuff is tear, so the tendon will not fully attach anymore to the head of humerus. Basically, there are two types of tears, which is partial tear and also full thickness tear. The partial tear will damage our tendon, but it's not completely tears. While for the full thickness tear, it will separate all of our tendon from the bone and also will completely tear. So the last one is the shoulder impingement. The shoulder impingement is located at our rotator cuff between the head of humerus and the acromion. Basically, when this injury occurs, the tendon of rotator cuff will pinch the subacromial bursa in the narrow space under acromion, and it will cause our bursa and tendons become inflamed and swollen.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is ATIF. Thank you, Anwar. Common injury at the shoulder joint. The first one is shoulder instability. It more often to the young people and athletes. The shoulder instability happens when the muscle and ligament that hold it together stretch exceed normal limit. It can cause pain, feeling shoulder loose, and weakness in the arm. The next one is rotator cuff tear. Rotator cuff tear happens when the tendon of the rotator cuff tear and make the humerus cannot move easily in the socket. It can cause to moving the arm up or away from the body become hard. The rotator cuff tear can happen when the tendon start degenerate and lose strength. It often happens to the middle age or older adult. The next one is a frozen shoulder. Frozen shoulder happen when if the shoulder has been immobile for a period of time. It also happens when the minor shoulder injury heals with the scar tissue that can affect the movement of the joint. The symptom of the frozen shoulder is not able to move the shoulder without any pain. Frozen shoulder can affect people with diabetes, thyroid disease, heart disease, and Parkinson's disease. Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Atif bin KHIRULANUAR. I will proceed to the mechanism of injury. First injury is a AC joint injury. The symptom for the AC joint injury is feel pain over AC joint, abnormal contour of the shoulder, and then causes for the AC joint injury is caused by direct trauma to the lateral aspect of the shoulder and falling on the outstretched hand or elbow. For the next injury, which is shoulder impingement injury, the symptom for the shoulder impingement injury is shoulder and arm weakness, minor but constant pain in your arm, pain when arms are extended above head, feel pain when lying on the affected side, and last one is pain and tenderness in the front of the shoulder. Next, the causes for the shoulder impingement is caused by a tendon is torn or swollen. Usually, tendon is torn or swollen is from age-related wear and tear. And then, overuse, acromion is not flat. Develop age-related bone spur on acromion. Then we go to the rotator cuff tear injury. The symptom for the rotator cuff tear injury is feel pain when raising arm. When you try to raise your arm, you will feel the pain on the arm or on the shoulder. Shoulder weakness. Usually your strength of the shoulder will decrease. You will notice the shoulders, your strength at the shoulder. Pain when lying on the affected side. When you try to sleep and lying on the affected side of your arm, for example, your right hand is injured, and when you try to lie on the right side, you will feel the pain. The next, pain when lowering or lifting the arm, and crackling sensation when moving the shoulder in certain position. Okay, the causes for the rotator cuff tear is caused by degeneration, overuse, falling on the outstretched hand. Overuse is when you do some movement repetitively, then you will cause the rotator cuff tear. You cuff tear overuse.
The patient need to be in standing or sitting position. Bring the arm into 90 degrees of abduction and external rotation passively. Then tell your patient to hold this position and release your supporting hand. This test is positive for full thickness tears of the supra and infraspinatus if your patient is unable to slowly control the downward movement. The patient is seated with her shoulder is 90 degree of flexion and internal rotation, and the elbow is 90 degree of flexion. The patient need to horizontally abduct her arm while against isometric resistance. Positive test can feel the pain at the AC joint. For the do's and don'ts, for the do's part, you need to do the test slowly with no rush, and you need to ask the patient either he or she feel the pain during the test. For the don'ts part, the test should not be done in rush, and do not do the test over the patient limit until he or she feel the pain. And for equipment, there are no equipment needed for this test. I think that's all from me. Thank you.
The procedure of ripple test. No equipment needed. Patient can be in a standing or sit position. Ask their patient to flex their arm 90 degrees, then like that until their hand is opposite the other shoulder. Patient need to resist their arm while I'm going to apply the force downward towards the arm. Don't put more pressure if the patient feel pain. The result is positive if the patient feel pain. Lastly, always ask the condition of patient.
Okay, so now I will do the internal rotation leg sign test. So the purpose of this test is to test the rotator cuff tears of subscapulary tendon. Now I will proceed to the test. So for the first step is to make sure the patient is seated while the examiner is behind the patient. The affected arm is bring into the maximum internal rotation behind the back, like this. Control the patient arms at elbow and wrist, then bring the arm or hand away from the back until 20 degrees of extension, like this. Instruct the patient to maintain this position as the examiner release the wrist but maintain support the elbow. Okay, so if the patient can maintain the subscapularis behind its back, it means the result is negative. If the patient can maintain the subscapularis behind its back and touch the lumbar region, it means the result is positive. Okay, now for the do's and don'ts. For do's, stop when the patient feels pain. Support the patient arms in comfortable way. For the don'ts, do not support the patient's arm in uncomfortable position. And lastly, do not force the internal rotation until the patient feels pain. For the equipment, there are no equipment needed in this test.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Aiman bin ISMAIL. So now I will do the infrasynaptic test for the shoulder injury. So this test is for subacromial impingement or rotator cuff tears. So first of all, the patient need to stand straight and up at the side. Okay, and then the elbow flex to 90 degrees. And then I will apply the medially directed force, and the patient need to resist the force. Okay, the result of the test will be positive if the patient feel pain when resist the force. Okay, and then for the do and don'ts, for the do, apply the force gently and stop when the patient feel pain. And for the don't apply the resistance to height to the patient. For the equipment, no equipment is needed.
Okay, I will explain to you about Hawkins-Kennedy impingement test. For purpose of Hawkins-Kennedy impingement test is to identify the possible acromial impingement syndrome. And the do and don't for Hawkins impingement Kennedy test is for do is to stop when the patient feels the pain, and for don'ts in the Hawkins Kennedy impingement test is do not force the arm of patient to rotate if the patient feels the pain. For the equipment, in the Hawkins Kennedy impingement test, there are no equipment needed for the test. Okay, now I will explain to you step by step how to conduct the Hawkins Kennedy impingement test. First thing first, to tell the patient to stand straight, and then make the patient shoulder flex at 90 degrees. On the front view is going to be like this. On the side view is going to be like this. And then flex the elbow of the patient also at the 90 degrees. For the side view, for the front view, and then rotate the patient hand internally. For the side view, if the patient feel pain, the test is considered to be positive.
So, with the special test, it gives a lot of benefit and easy for us, especially for the doctors or the physiotherapy to identify the injuries that occur towards the athletes or the patient. If someone feels uncomfortable with the shoulder after having an accident or injured during the game, we suggest for them to get referred to the doctors or the physiotherapy so they can identify the degree of your injuries. Don't ever do your own decision by doing something that can lead your injuries getting worse. So I think that's all for today. Thank you.
Y bésame muy